if you have a word such as healthcare, the word alone we should be able to extract meaning out of that word.
Mm-hmm.
Care, providing care that would produce health.
Right.
Health care, health promoting care that promotes health. That should be a logical understanding of what healthcare is.
Right. Caring for people's health.
Right. If you generally talk to somebody about healthcare, they have a picture of what that looks like. Let's define the picture of what most people understand to be healthcare.
Yep. So typically, healthcare for people is a system that you enter into when you have something wrong with you, like you feel bad, or you have a symptom, or you have something that triggers you to go see a medical doctor, and that medical doctor asks you about your symptom. They give a diagnosis to that symptom through their history, the consultation with you, and doing some sort of medical tests. And then typically they come up with some sort of treatment, which in our healthcare system, the two tools are drugs or pharmaceuticals and surgical procedures to get rid of that symptom, to manage that symptom. That's what the healthcare system is.
And
talk to a doctor, get a test, get a medication, do a surgery.
And in order to really be a part of this system effectively, you also have to carry healthcare insurance.
Yes.
To actually be a player in any of this.
Right. So that's a good point. So I'm a chiropractor. So sometimes patients of mine will use their insurance to get reimbursed for what they pay for, how they pay me for their care.
Yeah.
In order for them to get reimbursed, what I have to show to send to the insurance company, the person paying me, is that what I'm doing for that particular person is medically necessary. So it's not chiropractically necessary, or what I would say health necessary for their health, right? It's medically necessary. So what we call healthcare insurance is really just medical insurance. Basically, they pay for stuff that they deem as medically necessary to do.
So how do they define medically necessary?
You have to have some sort of a diagnosis and show functional deficit, which is based off of activities of daily living primarily. Like a person, can't walk, they can't sleep, they can't do daily activities. Mm-hmm. That's typically what's medically necessary.
Mm-hmm. Right. Okay. So if the tools in the healthcare system are pharmaceuticals and surgeries, I suppose in some way that is preserving life in some circumstances.
Yep.
Can we equate that to health?
I do not think so. But look at this. I just looked up the definition of a medical doctor. So Google gives me physician. It says a physician, medical practitioner, medical doctor, or simply doctor, which is hilarious to me. That just basically saying even Google thinks when you think doctor, you think medical doctor, is a professional who practices medicine.
Mm-hmm.
When do you take medicine?
When you're sick.
You don't take medicine to stay healthy. You take medicine when you're sick, which is concerned with promoting, maintaining, or restoring health. So basically they're saying you go to a doctor because medical doctors promote, maintain, and restore health. to people. So there's some, we would have to define some of these words, right?
Yeah.
But it says through the study, diagnosis, prognosis, and treatment of disease,
Mm-hmm.
injury, and other physical and mental impairments. So basically what they're putting together is health equals when you don't have a disease.
Mm-hmm.
If you have a disease, you don't have health. So then to restore your health by
And
diagnosing, prognosing, and treating that disease.
so me hearing that, I see a couple problems with it. The first would be that you presently have a disease,
Mm-hmm.
right? So in this specific moment, you have a diagnosable disease. So one of the problems with that is, like, let's take a surgery that came about because you developed X, Y, or Z. This is to remove something, okay? If it's true that the natural state of the human being would be one that is always working back to health, something had to go wrong to get in the diseased state that some growth was happening on you, or whatever, that required a surgical removal of the thing,
Mm-hmm.
right? The moment after that surgery is done, you don't have the thing,
Right.
right?
So by their definition, you went from sick to being healthy.
Right.
Without any thought of what led to that growth.
How did that get there in the first place?
Yeah.
Yeah.
So there's a chiropractor named James Chestnut. He gives a great analogy of this sort of thing. He says he basically calls the what we call our healthcare system, what we would say is a sick care system, or just even the medical profession. They are the fire department.
Mm.
Basically, your house is burning down. They
Right.
come, they spray your house down. They use an axe to break the door down to get
Yeah.
inside to save people's lives, right? So then they stop the fire, but then you would never ask people to invite that fire department back to continue to spray down that house every single day after that,
Yeah.
right? What would you need after that? Well, you would need now somebody to come in with different tools to
Right.
restore that house back to health, or
Right.
the way that it's supposed to be, right? But the way we think about healthcare is we're willing to stay kind of in that burnt down state until we start to recognize and become aware of how burnt down we are, and then we call the fire department again to come in and use their tools to
Right.
try to bring us back to health.
Right. In this analogy, the fire department obtains very valuable tools.
Absolutely.
The Western system of medicine obtains some very valuable tools, many of which are find their fullest and truest and most valuable place in emergency situations.
Right.
If we don't have a good understanding of health, what is normal, what becomes normal is running to this system that's really great at putting out fires, dealing with emergency situations, life-threatening situations. The tools that they're going to apply to situation that is not an emergency are still emergency tools.
Absolutely. So they're not helpful in doing anything other than getting somebody out of an emergency. But the way we understand it is we either wait until there is an emergency to do something about our health. So to use the healthcare systems, we wait until we have an emergency, or we use their emergency tools for things that don't require. So again, back to spraying the house down instead of using construction worker tools to build the house back up.
Right.
Right. Which gets back to what you were saying with the growth example. So take a different example, like something like high cholesterol or high blood pressure, right? The tools that the healthcare system we currently have use is giving medication to bring blood pressure down, giving medication to bring cholesterol levels down. Instead of asking, well, why is this person's blood pressure high? Why is this person's cholesterol high? And then maybe it's so high that it is an emergency where we need these medications to bring it down to relieve suffering or to stop something worse from happening. But to think that that's okay to do for the rest of that person's life and never address why is their body in that particular state, and then doing something to help that person with that environment that they continue to put their body in,
Right.
is not promoting health. It's not restoring health. It's managing symptoms. It's managing sickness.
Right. So it's like if to make your fire department analogy even, I think, more applicable, if there's a gas line leading into the house and it is leaking at all times, anytime there's a spark, a flame, the whole thing is going to catch on fire.
Yeah.
Because it's full of gas.
Right.
And if we continue to pour water on it to put out the big fire that's happening, needs to happen. But if our only tool is the water hose,
Right. And waiting for a fire.
right, and waiting for the next match to be lit,
Right.
we're doing nothing to really deal with what's going on here.
Right.
So okay, I think we've done a good job of saying if you say healthcare, the thing that comes to most people's minds should actually be called sick care.
Mm-hmm.
What would healthcare look like?
Well, the majority of caring for one's health wouldn't require a doctor, right? Or majority of caring for one's health would be, if you're doing healthcare right, you would be avoiding emergencies, you would be avoiding symptoms and sickness and disease, so you wouldn't need emergency type care, right? So that would be understanding how the human body works, understanding this whole principle that we talk about of giving the body what it needs and staying away from what it doesn't. I mean, that's a good definition of caring for your health, right? Is giving the body what it needs, stay away from what it doesn't. From a food perspective, from what's required of the human body from movement, from rest, what kind of relationships, emotional state, what's healthy for the human body, what sort of things in our environment do we need to try to minimize or eliminate. Those are all things of caring for your health. Now, can there be experts in those particular areas that can assist and guide? Absolutely. Lead people in that. But we shouldn't need to go to some sort of an expert to try to save us, to try to care for us in a way that brings health. Most of that is done in our own, it's our responsibility, I guess, is what you would say.
Right. So if Western medicine is actually sick care, that's what causes us to say things like, we believe the healthcare clinic of the future is the gym.
Right.
And the healthcare provider is the coach, not a doctor.
Mm-hmm.
A doctor is a provider of caring for sickness, of caring for potentially emergent situations.
Right.
Be it a surgeon or a medical doctor, whatever it may be. Their scope is something distinctly different.
Right. And we just had an example of this the other day. A client who's now doing some nutrition coaching with us. She was saying, I have all these issues, and I asked my doctor about what I need to be doing, and he didn't give me any sort of recommendations as far as what to eat or what do you do for exercise standpoint. And so to her, it's like, what do you mean? I'm coming to you because I'm unhealthy and I want health. You're the expert. But in reality, that's just a misunderstanding of what that doctor is there for.
Right.
That doctor isn't there to give you nutritional recommendations. And if they are, it's to manage a sickness, right? So somebody who has diabetes, they're giving you recommendations, or more than likely sending you to a dietitian or somebody to give you recommendations for what you should be eating to manage your symptoms and disease. It's never to, here's what you do to restore health back to your body. That's where, like you're saying, the future, if we want to get out of the current state of health that we are in America, it will be taking responsibility of this yourself, but also getting a coach to lead you in that direction.
Yep. So even there's an underlying truth that we also have to understand with all this, that we have a chronic disease epidemic.
Yes.
We are in the midst of a chronic disease epidemic.
But it's not from a lack of good health care the way we in America define healthcare. We have the best healthcare system in the world. It's because we have the wrong definition of health.
Right.
And how we care for that health is...
We have the best sick care system in the world.
Right.
So
we can take care of sick people and continue to manage their sickness and maybe prevent them from dying. But we don't do anything to promote health. And this is not our opinion. I mean, so I'd say this in my talks a lot. There was a meeting, the World Health Organization, which is basically they're designed to try to keep the world healthy, right? Come up with public health policy. And they had a meeting where they got experts together and they wanted to ask this question of, okay, why is America, the United States, have so much sickness? Why do they have all these chronic diseases and lead the world in diabetes and heart disease and depression and chronically sick people? And one of the experts said it's because of the healthcare system that they have. Only 0.1% of the dollars that is spent in the United States on healthcare, which is about $3 trillion every single year, is spent on health promotion, which means 99.9% of the dollars is spent on symptom and disease treatment. So somebody's already sick, let's figure out how to treat and manage. It's never how do we actually get somebody healthy and promote it and maintain health over the course of their life. We don't have it at all in our current healthcare system.
So, sick care system is necessary, but we better know that it's sick care. And if health is actually what you're after, they probably can't help.
No, not at all.
Yeah. Healthcare clinic of the future is the gym. Healthcare provider of the future is the coach.